Unit 3, Drug Therapy and Dosage Calculations, Section C and D Calculations. Here are your objectives, and these are your reading assignments. In Section C, we're going to be learning how to interpret medication orders and drug labels. In order to do so, we have to figure out our abbreviations, and also it is very important to know military time. Please remember how to change your regular times to military time. So how do we write the time in military time? So it's pretty much very similar. So midnight, it's 000, 1 is 0100, 2 is 0200, and so on, right? Until 12 p.m., which is 12. But after 12 p.m., 1 p.m. is going to be 1300, 2 p.m. is 1400, 3 p.m. is 1500, 4 p.m. is 1600, 5 p.m. is 1700, 6 p.m. is 1800, 7 p.m. is 1900, 8 p.m. is 2000, 9 p.m. is 2100, 10 p.m. is 2200, and 11 p.m. is 2300. So please learn military time from now on. Moving forward, it's really good practice to use it in your everyday thing, and that way it gets kind of incorporated in your everyday life, and it becomes easier to make those conversions in your head. So please remember military time. So medication administration abbreviation, so please remember these. AC stands for before meals. PC is after meals. An easy way to remember AC, for those of you, especially if you speak Spanish or a similar language, AC is antes or before. C is comer. So antes de comer, AC, before meals. And then PC, después, so pues de comer, that's going to be after meals. Anyway, I hope that helps. If it doesn't, just memorize it. Anyway, so next would be daily, QD, or Q.D. So this should be written out, ideally, to prevent any medication errors or misunderstandings. So daily, so it means every day, once a day, daily. Anyway, BID is twice a day, TID is 3 times a day, QID is 4 times a day, QH is every hour, HS or H.S should be actually written out. It actually stands for at bedtime or hour of sleep. That's why HS. Stat is right away, immediately, now. So that's stat. Q2H is every 2 hours, Q4H is every 4 hours, Q6H is every 6 hours, and so on. QOD should be written out because it can be confused with QD. So QOD is actually every other day. PRN is as needed. TIW should be written out as well, but it stands for 3 times per week or 3 times a week. BIW is twice a week or twice per week. Route of administration abbreviation. So AD is right ear, but ideally you want to write it out. AS is left ear. AU is basically each or both ears. HHN is handheld nebulizer. IM is intramuscularly. IV is intravenously. IVP is intravenous push. IVPB is intravenous piggyback. MDI is metered dose inhaler. NEB or NEB is nebulizer. NGT or NG is nasogastric tube. OD, which should be written out, means in the right eye. OS should be in the left eye. OU is in both eyes. Again, this thing should be written out because it can be easily confused with other things. PO is by mouth or orally. PR is in the rectum or perectum. Subcutaneously or SQ, ideally you want to write it out to avoid confusion, but it means subcutaneously. SL is sublingual or under the tongue. SNS is swish and swallow. Parenteral medication. So as you know from earlier discussion, that parenteral medication is basically a route of administration wherein we bypass the GI tract. So we're not going through the GI tract. Routes of administering parenteral medication include all medications that are not ingested or introduced into the GI system. So they include topical, ophthalmic, otic, vaginal, nasal, inhaled, injectables, intradermal, intramuscular, IM, sub-Q, IV. And know that the injectables are the fastest when it comes to absorption. So they get absorbed the fastest. So if you want something quick to work right away, then injectables would be the right route to choose. Anyhow, subcutaneously or sub-Q, a subcutaneous injection is one that is given in the fatty layer of the tissue under the skin, and the maximum amount of fluid an adult can safely be given subcutaneously is 1 ml. Sometimes you may see this abbreviated as ST, SQ, and so on, but you should never abbreviate it this way. So if you see it, know what it stands for, but if you're the one writing it, please avoid that. Don't write it that way, since these outdated abbreviations have often been misread, leading to medication errors. Intramuscularly, or IM, basically an intramuscular injection is one that is given in the muscle. The maximum amount of fluid an adult can safely be given intramuscularly is 3 ml, and for a child, the maximum is 1 ml. If the dose is larger than 2 ml in an adult, the deltoid should not be used. A larger muscle like the ventral gluteal muscle should be used. So again, take in consideration, right, the amount of medication that you're going to be ingesting. And then sometimes if it's really hard for you to think that way, I always tell my students, think about it. If that was you, right, if they have to give that much medication, do you want them to administer it on your deltoid or your shoulder area? Do you think that's going to be comfortable? If it's greater than 2 ml, most likely it's not going to be comfortable. So think about that whenever you're choosing how to administer a medication. Intravenously, or IV, is basically an injection that's given directly in the vein. So this usually can be given with much higher amounts of fluid, and LVNs in California can administer IV fluids and blood products after being IV certified, but otherwise they are unable to administer other IV medications such as IV pushes and IV piggybacks, and even antibiotics, chemo, and so on. So types of syringes used for parenteral medication. There are several different sizes of syringes that might be used for medication administration. So you should always use the smallest possible syringe in which the dosage will fit, because the smaller the syringe, the more accurately you can measure the dosage. So 3 ml syringe. 3 ml syringe, this is the most commonly used syringe. As its name suggests, it holds a total of 3 ml fluid, and for every 1/10 of an ml is marked on that syringe, and every 1/2 ml is also labeled. So if you can see here, this is a 3 ml syringe, right? This is 1/2 ml. So 1, 2, 3, 4, 5. So this is 0.1, 0.2, 0.3, and so on. And this is half. This is 1 ml. This is 1.5. This is 2 ml, and so on. Anyway, so when you are administering a medication that is 1 ml, well, above more than 1 ml, this needs to be rounded to the nearest tenths. Basically, because looking at the equipment that you're going to use, that's the only thing you can measure at this point, right? You can't measure it to the hundredths place. So that's why you round it to the tenths place. So again, dosages between 1 to 3 ml should always be measured in a 3 ml syringe. Just be very careful. Look at the labels carefully, because there are some syringes that look like they're mLs, but they're actually not labeled to be used for mLs, but they're actually minims. So this is how it looks like. So just be very careful with that. Just make sure that they are mLs, and it's usually written in the syringe. Tuberculin syringe. A tuberculin syringe is used to measure small doses, so it is often used to dose small children and infants. There are 2 different sizes of tuberculin syringes which you might encounter. One kind can hold a total of 1 ml and the other kind can hold a total of 0.5 ml. So the weight level, it's labeled for every 100 of ml. So you'll see that it's marked for every 100 ml. And usually you use this syringes for dosages or amount of medication that is less than 1 ml. So 5 to 12 ml syringes usually used when giving IV medications. They can hold about 3, 5, 6, 10 ml and so on. And when you're looking at how they are labeled, how they are lined on each of these sizes, every 0.2 or 2/10 is marked. So be very careful not misreading it as a tenth of an ml. So again, read them carefully and double check it whenever you're drawing up your medication, because you don't want to administer more or less than what's supposed to be given to the patient. So this is how they look like. And again, looking at this, so this is a 6 ml syringe. So for every line is actually 0.2 ml. So be very careful when drawing medications. This is an example of a 20 ml syringe. For 20 ml syringe, each line is basically an ml. So again, get used to this type of syringes and look at the labels very carefully so that you won't accidentally give the wrong dose to your patient. Measuring dosages in a syringe. So to measure a dosage in a syringe, we must line up to the top of the block rubber plunger exactly with the line that marks the dosage we want to administer. So this is an example, right? When you're looking at this, make sure that you're not using the bottom one, but it should be this top line over here, and that's what should be in line with the amount of medication that you need. So if we look closely, we can see that this syringe has the top of the block rubber stop lined up with the third mark past the 2. Since this is a 3 ml syringe and has every tenth of an ml mark, that means that we are 3/10 past 2. So this is, if you look at this, 2, this is 2.1, 2.2, 2.3. So this is 2.3 mLs. All right, the next example, this is for a 2.6 ml. So when you're looking at this, make sure you're not looking on the left side because that's for the minims. Make sure you're looking in here. This is actually for ml. I think this is an older syringe. It says cc. Anyhow, so for 2.6 ml, you have to again look. So for each line, that's basically 0.1 ml. This says half, so this we're at 0.5 and we need 2.6, right? So where's 2? This is 2 and I'm gonna count 6 lines. So 1, 2, 3, 4, 5, 6. So this is where this line should stop, right? The top black line. I'm not gonna go over each one because it's basically very similar. It's the same concept, just getting used to looking at the syringes and knowing, what the line stands for. And just be very careful when choosing the syringes or the equipments that you're gonna use for whatever medication that you're gonna administer. So these are more examples. So please read them. All right. And then next, let's talk about reading medication labels. There are different ways wherein we can administer medications or routes. So drugs can be given orally, by mouth, injected, and so on, right? So medications that are injected are called parenteral medications. Anyway, stock medications stored in the office must be labeled. So if you have something stored, make sure that they're labeled appropriately, that they have all the necessary information so that we can administer it safely. We don't want to be guessing, right? What's in it? What's the dose? When was it expired? And so on. So a medication should include all these labels. It should have a brand name if it has one, a generic name at the minimum, drug strength, drug form, route of administration, the total amount of medication in the container, directions for reconstitution if it's a medication that we have to basically mix together, NDC, which is a number or kind of like an identification number so that we know from like the database, we can look it up and we know what medication is in there, and it should have an expiration date and a lot number. So this is an example of a drug label that has all that information, and information should also include any pertinent warnings regarding that medication. So for this specific example, this is diphenhydramine capsules or Benadryl. For this specific one, the brand name is actually Itchasin. It has some warning. It says finish all the medication unless otherwise prescribed. May cause drowsiness or dizziness. Do not crush. Do not drink because it can interact with the medication. We're talking about the NDC, which is an identifying number. This is the brand name. This is the generic name. This is the dose, and this is how many capsules are in here. So the distributors, expiration date, and the lot number. So this is typically how you wanna, the label of the medication that's being stored, you want it to look like, right? Because you want to have all this information. If something is missing, right, it can cause some problems, because then how do we know if it's expired? How do we know if this, how much medication is in each capsule, and so on. So making sure that the medications are labeled appropriately is very important. So these are some more examples. So this medication right here, so if you're looking at the label, right, so you want to look at the trade name. So trade name is Verelan, and then the generic name is Verapamil hydrochloride. The dosage in units, so it actually comes in 120 milligrams. And in administration units, so it says here that it is a sustained release pellet filled capsule. So it says here it's a capsule. So concentration, so it tells us here, right, that each capsule is 120 milligrams. So each capsule is 120 milligram. Make sure to read it carefully, to not assume that there's 120 milligrams in 100 capsules, right? So read them carefully. Here's another example. We have Thorazine. So Thorazine is the trade name, and then the generic would be chlorpromazine hydrochloride. As you may have noticed, trade names are easier to pronounce, while generic names are a little bit more complicated. They sound a little bit more chemically and scientific. Dosage unit, so when you're looking at it, the dosage is actually in milligrams. Administration unit, it looks like it's in ml. Concentration, so concentration is basically how is it supplied. So it says here that for each ml, there's 25 milligrams. So 25 milligrams per ml. This means that there are 25 milligrams in each ml of medication. The total amount in the package is 10 ml. Don't assume that the whole thing is 1 ml, right? So it says here it's a multi-dose vial containing 10 ml. So if you end up administering all this, right, the 10 ml, this is actually 250 milligrams, right? That's going to be too much for a patient. So again, read your labels very carefully. This is another example. The trade name is Procan. And then the generic name is prokinamide hydrochloride. The dosage unit, so this one can be a little tricky, right? Because it doesn't really say the units. Let's see here. So it says here 750. This one, I haven't seen a prokinamide tablet, like, I don't know, it's been ages. They're not very commonly prescribed anymore. But anyway, so for this specific one, this is actually 750 milligrams per tablet. So this comes in tablets. What else? And then this one, it seems to just come in one. Now, sometimes if it's the actual like whole bottle, it will label the whole thing and it will tell you that there is, 100 tablets per bottle. Here's another example. We have our trade name is Cleocin phosphate, and then our generic is clindamycin phosphate. So Cleocin, typically the way to differentiate, it's not always the case. Some manufacturers will print it differently, but normally your trade names will start with capital letters, and then your generic would be in all lowercase. The dosage unit, it comes in milligrams. The administration unit, so if you're looking at how does it come, so for this specific one, it comes in 6 ml vials. So we know that this is a liquid medication, so it comes in mLs. So the concentration, based on this, so this is, when you read the whole packet, this is 900 milligrams in a 6 ml vial. So that's your concentration. Let's go over this syringes and medication cups. So these are the different types of syringes. So these are, if you're looking at this, it says units. This right here, these are insulin syringes. So something that you have to remember moving forward from now and then all the way to your nursing careers, as long as, you know, they have the appropriate supply in your hospital or facility. Make sure that when it comes to the insulin syringe, you can only use it for insulin only. So let's say the order is 5 units, then you just draw it up to the 5-unit mark. So this comes in units, right? So this is for insulin only. Now, it may be confusing because the tuberculin syringes or 1 ml syringes, they kind of look like insulin syringes as well. But if you look closely, right, this says ml. This one will say ml too. So again, be very careful when picking your syringes. Make sure that you're looking at the label and making sure that it's the right one. Now over here you have a, these are your oral syringes. So don't get them confused. Sometimes some medications will come in this syringes. So if it looks like this, and it usually is labeled now, usually if something like this is, you know, they change this, usually it's because something had happened. I can assume that somebody had accidentally administered maybe an oral medication via another route. So that's why now they're very careful. Typically, oral medications, syringes will have a different color and they will be labeled accordingly. And then this is a 3 ml syringe. These are droplets. So these are used typically for pediatric patients. So, you know, these are calibrated. For adults, obviously, you don't really often see this. Sometimes you may see this oral syringes, but it's not very common. These are some examples of medication cups. Just look at the label. Again, make sure that you are reading the units of measurement, because if you're supposed to give 10 ml and then you're looking at something else, you may end up giving a different amount. Kind of look at this one right here. It has 10 teaspoons and then you also have 10 ml. If you're not paying attention to the unit of measurement, you may end up giving more or less of whatever medication was ordered. So when you're looking at your equipments, you kind of have, you need to have an idea of the different parts, so that when we're talking about, you know, how to administer things, when we're looking at the steps of the medication administration, you kind of know, you know, what is it that we're talking about. So when you're looking at a syringe, you will see the bevel, which is the very tip, the opening. This is the needle shaft, and then the hub or opening where you attach it to the syringe. Now, when it comes to the syringes, this is a barrel, this is the plunger. And then for your syringe and needle sizes. So typically you're looking at this insulin syringes. Usually you want to use a 25 to 26 gauge needles, about 1/2 to 5/8 inches. The most common ones are 5/8 inches for sub-Q administration. Then this would be your 1 ml injection. So you may need to use this for maybe sub-Q or IM. Typically, you use this for sub-Q. Usually IM, we give a little bit of a higher volume medication, but again, it depends on the medication. But this is what you commonly would see. So you would use 20 to 28 gauge. Needle length would be 5/8 to 7/8. And then your 3 ml syringe, we usually use it for IM administration. And we usually use 20 to 23 gauge needles. And then the length, it varies. It can be 1 to 1.5 to 3 inches, depending on the site of administration. So depending, is it going to be on the deltoid or maybe a smaller framed patient? Or is it going to be on the gluteus maximus or a bigger patient? So those are the things that you want to consider when choosing the needles to administer the medication that was being ordered. So please review this, be familiar with the sizes of needles. And so when it comes to needle sizes, so needles usually used for intradermal injections are a lot smaller, right? So they're about 3/8 to 5/8 in length and then about 25 gauge. So these needles are very short. And then again, this is usually, you will see it used for the PPD testing. Now, needles for subcutaneous administration. So this is probably one of the most common ones that you will see. Typically, they're 5/8 in length. And then their needle gauge would be 23 is the most common, but it can range from 23 to 28. And for IM administration, they're usually 1 to 3 inches long, and their circumference or gauge would be somewhere between 20 to 23 gauge. There are some instances that you would require a lower gauge, which means it's a bigger needle, depending on the consistency of the medication, but that's not very common. So needles for IV use are 1 to 3 and have long bevels, and they can range from 14 to 25 gauge. So again, for gauge, the smaller the number, the bigger it will be. So here are different injection sites for adults. So you have the intradermal injection site. So it's usually in the inner aspect of the forearm. So again, commonly done in PPD. For subcutaneous injection, we use the upper arm, thighs, lower abdomen, upper back. So wherever really we can pinch a good amount of fatty tissue where we can administer a subcutaneous medication. IM, on the other hand, common places would be the deltoid, ventrogluteal, and then there are some places that they actually use the dorsogluteal, but is no longer being used and discouraged just because of potential injury to the nerve in that area. And then the angle of administration. So depending on what you're administering, so for intradermal, it needs to be about 10 to 15 degree angle. For subcutaneous, about 45 degree angle. And again, you also want to consider your patient's build, like how much subcutaneous tissue is in there, because sometimes if it's a pretty thick subcutaneous tissue, then you may get away by administering it a little bit more straight rather than 45 degree angle. And now intramuscular, it's going to be a 90 degree angle. So when you're looking at it, you can see where you're actually targeting.